Good day, everyone. We are the Group 5 and we are going to present the diagnosis of pregnancy. So, before there were sonograms and maternal serum pregnancy tests, pregnancy was diagnosed and symptoms reported by the woman and the signs elicited by a healthcare provider. These signs and symptoms, still important today, are traditionally divided into three classifications: presumptive, probable, and positive signs. Presumptive signs of pregnancy are subjective. These are least indicative of pregnancy as they could easily indicate other conditions. These are taken as single entities and experienced by the woman but cannot be documented by an examiner. Probable signs of pregnancy are objective, so they can be documented by an examiner through number 1, laboratory tests, where there's a presence of human chorionic gonadotropin, a hormone created by the chorionic villi of the placenta, in the urine or blood serum of the pregnant woman. Blood serum tests give earlier results. Second, are home pregnancy tests. Several kits for pregnancy testing based on immunologic reactions are available over the counter. High degree of accuracy, about 97%, if the instructions are followed exactly. However, they may get false positives. Positive signs of pregnancy. There are only three documented or positive signs of pregnancy. Number 1, demonstration of a fetal heart separate from the mother's heart. Number 2, fetal movements felt by an examiner. And number 3, visualization of fetus by ultrasound. So what happens during the first week from the time of implantation? During this week, there are still no presumptive and positive signs of pregnancy, and probable sign of pregnancy is determined through serum laboratory tests, where tests of blood serum reveal the presence of human chorionic gonadotropin hormone. During the second week from the time of implantation, presumptive signs of pregnancy are breast changes, where there's a feeling of tenderness, fullness, or tingling, and enlargement and darkening of areola, nausea and vomiting, amenorrhea or the absence of menstruation. There are no probable and positive signs of pregnancy during this week. During the third week from the time of implantation, presumptive sign of pregnancy is frequent urination, where there's a sense of having to void more often than usual, and there are no probable and positive signs of pregnancy during this week. During the sixth week from the time of implantation, there are no presumptive and positive signs of pregnancy, and probable signs of pregnancy are Chadwick's sign, Goodell's sign, Heger's sign, and sonographic evidence of gestational sac. Chadwick's sign is the color change of the vagina from pink to violet. Goodell's sign is the softening of the cervix, and Heger's sign is the softening of the lower uterine segment. There's also amenorrhea or absence of menstruation.
Week 8. So for the positive signs of pregnancy, we have the fetal outline evidence, so it could be seen and measured by a sonogram. So a sonogram is an image produced by ultrasound. Week 10 to 12. On positive signs of pregnancy, we have fetal heart is audible, so via Doppler ultrasound, we could hear the heartbeat of the fetus. Week 12. So for the presumptive signs of pregnancy, the mother would experience fatigue or extreme tiredness and uterine enlargement, and uterine can be palpated over the symphysis pubis. Week 16. So for the probable signs of pregnancy, we have ballottement. So ballottement is a test that is conducted during pregnancy by feeling the return impact of the displaced fetus. So this is a similar procedure for detecting a floating kidney. So when lower uterine segment is tapped on a bimanual examination, the fetus can be felt to rise against the abdominal wall. The next, week 18. So for the presumptive signs of pregnancy, we have quickening. So quickening is the movement of the baby for the first time. So obviously the fetal movement is felt by the mother. Week 20. So for the probable signs of pregnancy, we have here Braxton Hicks contractions and fetal outline felt by examiner and can be palpated through the abdomen. So Braxton Hicks contraction. So this is referred to as the false contractions, as this occurs periodically with the tightening of the uterine. So this is typically less painful than true labor. So for the positive signs of pregnancy, we have fetal movement felt by the examiner and can be palpated through abdomen. And lastly, we have here week 24. So for the presumptive signs of pregnancy, we have linea nigra. So this is the straight line of dark pigment that forms of the abdomen along the navel. Next, we have melasma. So melasma is the dark pigment that forms on the face, and this is often referred to as the mask of pregnancy. And then we have striae gravidarum. So this is the stretch marks that form on the abdomen. So we have here a visual presentation for the comparison of assessing the client for presumptive and probable signs of pregnancy. So that would be all. Thank you.